The Hollister InView Male External Catheter is a self-adhesive silicone catheter designed for easy application. All Hollister InView catheters are latex-free and are manufactured with a formulation of transparent, non-irritating silicone. The InView catheter is an ideal solution for men who have a known sensitivity to latex. And because the catheter is clear, it allows the condition of the underlying skin to be easily monitored when the catheter is in place. The tapered tip helps to provide a secure connection to either a leg bag or other urine collection system. The Hollister InView Male External Catheter is available in 5 sizes and 3 different styles to accommodate a variety of needs. The standard InView catheter is a regular length catheter with a regular amount of adhesive for everyday wear. The InView Extra is the same overall length as the standard InView catheter, but the Extra has 70% more adhesive for additional security. The InView Special catheter includes a regular amount of adhesive, but has a slightly shorter overall length. The InView product packaging is color-coded to help simplify selection. Using the correct size catheter is important, both for patient comfort and to help ensure maximum wear time. To determine the correct size catheter, use the Hollister Catheter Sizing Guide, which is also color-coded to match the product packaging. Before measuring your patient's penis, wash your hands thoroughly. Next, put on gloves and wash your patient's penis with a mild, non-oily soap and water. For this demonstration, we are using an anatomical model. Do not use lotions, powders, or emollients on the penis or in the water, since those products can affect adhesion of the catheter. Dry the penis and remove any lint or other material that could affect adhesion of the catheter. If necessary, trim any excess pubic hair using blunt end scissors. Next, use the Hollister Catheter Sizing Guide to measure your patient's penis. It is important to measure the penis at the point of its greatest circumference, whether the widest point is at the glans or along the shaft. A catheter that is too small can cause discomfort for the patient. A catheter that is too large will not fit securely and may result in decreased wear time. For our anatomical model, the correct size catheter is intermediate, 32 millimeters. Discard the sizing guide and record the catheter size in the nursing care plan. Next, assemble everything you will need at the patient's bedside: the appropriate size catheter for your patient, gloves, blunt end scissors, a bedside drainage collection system or urinary leg bag with leg bag straps, and extension tubing. Next, remove the catheter from its packaging. Then, place your thumb and index finger under the rolled ridge of the catheter. Squeeze your thumb and index finger together until the inside surfaces of the catheter are touching. Next, while still holding your thumb and index finger together, position the catheter against the glans of the penis. If your patient is uncircumcised, let the foreskin remain in its natural position as you apply the catheter. Next, simply unroll the catheter along the length of the penile shaft with as little wrinkling of the silicone as possible. As you unroll the catheter, a drawing motion toward the base of the penis rather than a pushing motion may help prevent your glove from being caught in the adhesive. Once the catheter is in place, gently squeeze along the shaft to ensure that the adhesive inside the catheter is adhering properly to the penis. Do not attempt to reposition the catheter once it is in place on the penis. If your patient's penis becomes erect during the application, wait until the penis becomes flaccid. Then, check the catheter for a secure seal. Once the catheter is in place, you can connect it to either a urinary leg bag or other urine collection system. Simply push the extension tube connector into the tapered tip of the catheter to ensure a leak-proof seal. If you are using a Hollister urinary leg bag, connect the other end of the extension tube to the leg bag connector. Then position the leg bag on the patient's leg. If you are using a Hollister bedside drainage collection system, connect the extension tube, then secure the bedside collector to the patient's bed. Make sure the bedside collector is lower than the patient so that gravity allows urine to drain into the collector. Both the urinary leg bag and bedside drainage collection system may be cleaned with Hollister M9 Cleaner Decrystallizer. The M9 Cleaner Decrystallizer will help the collection bags to remain fresh and free from crystal buildup. The Hollister InView Male External Catheter will help keep your patient dry and comfortable. Be sure to review your institution's policy to determine how long the catheter may remain in place on your patient. When it is time to remove the catheter, wash your hands and put on gloves. Gently ease the silicone material away from the base of the penile shaft. Then, simply unroll the catheter down the length of the penis. Finally, disconnect the tubing and discard the catheter. If you are going to reuse the extension tubing, it is a good idea to clean the tip of the tubing with an antiseptic solution before you connect a new catheter. As before, wash and dry your patient's penis before applying a new catheter. It is important to remember that the catheter should not be used on irritated or compromised skin. If you have a patient for whom the InView Male External Catheter is not an option, you may want to use the Hollister Male Urinary Pouch, which is also latex-free. The male urinary pouch includes a cut-to-fit synthetic skin barrier to protect the patient's skin, along with a convenience drain that can be attached to either a leg bag or bedside collection system. At Hollister, the range of continence care products forms a complete system for managing male urinary incontinence, a system of quality products designed for both you and your patient, a system of products designed to promote dignity and quality of life.